Here at EIS, we were concerned about consumers who don't come in for their appointments, and we were looking for ways to improve attendance. Research shows that non-attendance impacts the effectiveness of treatment, as well as the functionality of consumers, and increases their risk for hospitalization.
For our PI project this year, we decided to implement a strategy called the CARE Pathway, which is associated with the researchers who developed the Columbia Suicide Severity Rating Scale.
The CARE Pathway is a simple and effective way to increase consumers' access to care. The steps include making reminder calls before each session, making outreach calls to the consumers and emergency contact if the person is more than 15 minutes late for their session until a live person is reached. All calls are documented in the EMR, and the clinical staff use their Outlook calendars to log all no-shows. The no-show rate is calculated by dividing the numbers of scheduled sessions by the number of no-shows monthly.
From March to August 2017, we collected data. What we found is that this strategy decreased our no-show rate by 2.27%, and we are now below the national average no-show rate.
Going forward, we plan to continue this part of our workflow. We're also going to look at reasons for non-attendance and strategize ways to address those barriers.
Our clinicians knew that self-esteem was a significant issue for our students, but wondered how much stigma and self-stigma had an impact on that. We wanted a way to capture the underlying issue and address it specifically.
The students are very aware of the stigma that exists in society. It comes up a lot, but we didn't know how self-stigma fit into the picture. We also knew that we would need a formal way to educate the students about self-stigma, and we would need some resources.
For the past 4 years, the Division of Schizophrenia Research has been studying a new group therapy to reduce internalized or self-stigma with adults here in Piscataway. So when the Adolescent Day School was looking for resources on self-stigma, it was a natural fit for our two divisions to collaborate.
The research measurement shows that self-esteem and self-stigma issues were pronounced with our students. So we were ready for the next step. We received a specialized training on the narrative enhancement cognitive therapy for self-stigma from Dr. Silverstein's team.
The groups use a manual for both facilitators and participants, which includes several writing exercises. I think it helps provide a sense of ownership in the work.
Communication and coordination between the Division of Schizophrenia Research and the Rutgers Day School was essential to bringing this opportunity to our students.
This project shows the benefits of aligning resources and talent areas between various divisions in order to most effectively serve our clients' needs.
Collaborazione. How do we better translate, adapt, and apply evidence-based practices, EBPs, in today's behavioral health care systems for more effective and sustainable implementation?
The mathematical formula underlying the creation of IMR Regional Train the Trainer is revealing answers that move us beyond traditional training and consultation methods.
EBP squared offers an exponentially expanding spiral of workforce development opportunities. As a multiplier for EBPs, evolving better partnerships empower the application of these practices so improved client outcomes can be realized.
Let's meet our collaborators. IMR experienced practitioners, selected by their agency leadership, were granted protected time to participate.
Representing the spectrum of mental health services, this cross-functional team formed, stormed, and normed to become innovators, trainers, and agents of meaningful culture change. At the agency level, an infrastructure of IMR expertise is flourishing.
As a result, common impediments to sustainable implementation are becoming less disruptive. What do the metrics tell us? The benefits of this EBP have increased, the challenges decreased, and even more exciting, the methods of sustainability are being integrated into everyday work culture.
The mathematical predictability of this model produces a unique channel for the spirit, values, and delivery of an EBP to thrive in program settings. Take a closer look at our poster. How could you find ways to replicate these results in your EBP implementation?
Mindfulness is awareness that arises through paying attention on purpose in the present moment, non-judgmentally.
Mindfulness helps me be more in control of my emotions.
Mindfulness helps me to be more focused.
Hey, look over there.
Mindfulness helps me feel more relaxed.
Mindfulness helps me stay connected to my body.
Mindfulness helps me to just be. We hope you enjoyed our PI project for 2017. May your day be mindful.
You're a shining star, no matter